How's it going? This is Aneurysms by Tyler Fortune. Let's get into it. So, first, to start off, we're just going to explain what exactly an aneurysm is. Um, so, what it is an aneurysm is an enlargement of an artery that's caused by the weakness in the arterial wall. So, when the wall weakens, it allows part of the artery to balloon out and create this bulge-looking kind of artifact that you see in the picture here, whereas you see a regular artery compared to the aneurysm. Um, and So most times there are no symptoms, which causes fatal complications with aneurysms. They are extremely dangerous. And aneurysms at their most severe stage can rupture and actually cause severe internal bleeding, which can be very life-threatening. So now we have different types of aneurysms. So the first one we're going to talk about is aortic aneurysms. So the aorta is a large artery that begins in the left ventricle of the heart and passes through the chest and abdominal cavities. So the most common aortic aneurysm is the abdominal aortic aneurysm. It occurs in part of the aorta, that runs through the abdomen. Um, so roughly the normal diameter of the aorta can be between 2 to 3 centimeters, depending. But actually, with an aneurysm, the bulge can actually go beyond 5 centimeters, which is pretty crazy. Um, so the next one we have is actually the cerebral aneurysms. So with cerebral aneurysms, these are aneurysms in the arteries that supply the brain with blood. So they also go by a few other names. So you have intracranial aneurysms because of their appearance, and also known as berry aneurysms. So, so these aneurysms that rupture in the brain are very serious and can be fatal within a roughly significant amount of time, usually about a day to 24 hours. Um, and then 40% of brain aneurysms are fatal. So that's a pretty significant chunk of people that usually aren't going to make it through a brain aneurysm. But there's a percentage that do, which is, as you see here, 66% of those who do survive the brain aneurysm will actually end up in a neurological impairment or disability. So developing some kind of other impairment in the brain that might not allow it to function as well as it was before. Um, Moving on to the next one, we have the peripheral aneurysms. So with peripheral aneurysms, this is an aneurysm that occur in a peripheral artery. So there's multiple ones. So just going down the list, you have the popliteal aneurysm. So this is usually the most common peripheral artery, and it happens right behind the knee. So right where the popliteal is actually located. It's pretty self-explanatory. Then you have the splenic artery aneurysm, which occurs near the spleen, obviously. Um, the mesenteric artery aneurysm, which affects the artery that transports blood to the intestines. So that's a pretty significant one. The femoral artery aneurysm, which occurs right in the groin area. Carotid artery aneurysm, which occurs in the neck, right by the carotid artery, actually. The visceral aneurysm. So this is actually the um, bulge of arteries that supply blood to the bowel or kidneys. So that's a real important one, especially because kidneys are so important within our health and our bodies and help filter our blood and everything. Um, so moving on, we actually have the symptoms tab now. So what it is most aneurysms are clinically silent and symptoms do not usually occur unless it ruptures. So people can be going about their actual day, having a good day, and not even know that they might be having an aneurysm. It's something that can just pop out of the blue, out of nowhere, without any warning or anything. Um, so unruptured aneurysms they can still cause problems, like obstructing circulation, so blood flow, which is important within our bodies. So make sure you're getting blood to the tissues, and even forming clots that could obstruct smaller vessels within the body. Um, and then ruptured aneurysm symptoms, other ones are pain, dizziness, nausea, vomiting, shock, and also low blood pressure, which the low blood pressure, obviously, because of the obstruction, could be causing lack of circulation. So that goes hand in hand. So now we have the causes. So aneurysms, they can occur in any part of the body. Like we said, there's multiple locations, as we went through earlier. Um, and sometimes aneurysms can be present at birth as an arterial defect, but it's very uncommon. Um, but further research is needed to confirm why an artery wall weakens to cause an aneurysm. I mean, there could be multiple things like plaque buildup, stuff like that, that just cause stress on the arterial walls that cause it to weaken. So pretty much anything that causes that amount of stress on the arterial wall can cause an aneurysm. So stuff such as high blood pressure and things like that um, are really like not good for you because they can cause aneurysms by weakening the arterial walls. Um, Moving on. So obviously now we have the risk factors. So there are known risk factors that contribute to the cause of an aneurysm. So those include high blood pressure, obviously getting to if high blood pressure causing stress on the arterial walls, as I just said. Poor diet, that's pretty crucial for a lot of other diseases as well as aneurysms. You want to make sure you have a healthy diet, make sure you're not causing too much fat in your body to cause plaque buildups, stuff like that. Um, Obesity goes hand in hand with poor diet. If an obese individual has an aneurysm, it's really not good, especially because of the fact that their health is in the shape that they're in. Um, Family history, obviously, and also smoking is another risk factor that could potentially cause disruptions. So now we have the diagnosis phase. So with this, the type of diagnostic testing performed depends on the location of the aneurysm, obviously. So a few of the ones that we go through are the computed tomography angiography scan, so the CTA scan. So this is pretty much just a procedure where they take imaging that uses a combo of X-rays and computer technology to produce a cross-sectional images. So it just allows them to get a good look within the body. Then we have the MRI. So this is a combination of magnets, radio frequencies, and computer to produce detailed images of organs and structures within the body. And this really allows us to see what's going on within the body, depending on the organs, stuff like that. And then we have the arteriogram or angiogram, which is an X-ray image of the blood vessels that's used to evaluate various conditions. So when you get an X-ray image of the vessels, it really allows you to see if there is anything happening, such as plaque buildup, stuff like that. So what they do is they actually use this dye that gets injected through a thin flexible tube that's placed in an artery to make blood vessels visible. So within that dye, they can kind of see like flow and everything and what's really happening within the arteries and the vessels. And then for this, now we have the treatment stage. So when an aneurysm is ruptured, um, oftentimes emergency surgery is needed, obviously. Um, if unruptured, not all cases need active treatment, but they can be managed. So obviously, an aneurysm is something that you really want to take seriously. You don't want to put it off because if it does rupture, obviously it can cause, like I said earlier, severe internal bleeding, stuff like that, and just really, really bad complications, even brain impairment, stuff like that. Um, But going back to it, they can be managed. So monitoring the aneurysm, certain medications that can help, and then counseling the patient actually to change lifestyle factors. So if you have someone that's obese, if you have someone that's a smoker, something like that, really just talking to them and allowing them to understand the severity of their condition and allowing them to make that change in their life to benefit their health in a more positive way instead of not worrying about it at all. Um, so for the conclusion, we just have a few stats here. So roughly about 1 in 50 people, an estimated 6 million, in the United States actually have unruptured brain aneurysms. And like we said, they can cause no problems and they can cause problems. You just don't know. It depends on the person, depends on the severity of it. Um, but you don't want it to rupture because that's when it really, really gets severe and you make your problems a lot worse than if it were to go untreated. Um, then we have the Center of Disease Control and Prevention, aka the CDC. Um, so they advise that the aortic aneurysms contribute to over 25,000 deaths in the U.S. each year. That's a pretty significant number, and it's definitely something that within our society we can help change with just basic things such as our diet, less smoking, like we said. Because as we know, obesity is an ongoing epidemic in our society that just uh, not only leads to aneurysms but a lot of other complications within the health system, such as cardiovascular disease, stuff like that. You know, so really, just there are active ways to help prevent and go against these measures, and that's definitely something that we have to work towards. And then, so lastly, around 30, 1,000, around 30, 1,000 brain aneurysms ruptured in the U.S. each year, and 40% of these cases cause death within 24 hours. So, like we said, when you have an aneurysm, especially for like a brain aneurysm, you roughly have about 24 hours until it can be considered or can be fatal. It can be fatal within any time. But so that's just like it's a crazy statistic to me, and it's really something that we have to work towards and just overall try and maintain within our country and our society. And these are just the citations that we use for the information that we got. So that's it. Take care.